me, Hannah here again from Target Physio, and today I'm going to talk to you about tennis elbow. You might have also heard this called lateral elbow tendinopathy or lateral epicondylitis. So to explain a little bit about those terms, this is some anatomy showing what's going on in the arm here. This spot here on your humerus is called your lateral epicondyle, which is where your lateral epicondylitis comes from. And these muscles here are your wrist extensors. And this is the tendon of those wrist extensor muscles which attaches onto the epicondyle. So that's where you get your terminology of lateral elbow tendinopathy. You can actually isolate these muscles yourself if you find your lateral epicondyle, which is the sort of bony prominence on the outside aspect of your elbow. You'll feel a little bump. Then you want to run a few fingers just down a little ways onto this aspect of your forearm, and now try extending your wrist back. You should feel a little flicker of those muscles underneath. So I'm going to grab onto one of the muscle bellies there and show you. You might be able to see that little flicker of those muscles turning on. Now, what causes tennis elbow or your tendinopathies or your lateral epicondylitis, depending what you want to call it, is an overuse of those muscles and that tendon, or a degeneration of that tendon that attaches onto that bony area there. We see that as a common condition in those who work in professions with repetitive hand movements, so people who type all day, use a mouse all day in the office, people like labourers and tradespeople who might be using hammers all day, other tools all day, as well as your tennis players and your throwing athletes. Basically anything with repetitive movements that extends that wrist and makes those muscles work over time. So what you'll commonly see with this condition is people experiencing pain over that bony area where the tendon attaches, and with activities that load that tendon. So that's your throwing, gripping, shaking hands, lifting things. You might also have pain at night time after a long day of doing those activities. And sometimes you can also get a bit of nerve irritation, as there's lots of structures that run through that area that can become inflamed. So over the next few videos, I'm going to talk a little bit more about the management of this condition, how we diagnose it, and how the physios at Target Physio can help you with this one. Bye!